the vessel blueprint. How do we take care of the tubes of the body? How do we take care of these highways and interstates carrying all the nutrients? We're going to give the blueprint today on how that exactly happens. And so we're going to kick off out of the gates, diving into some specific conditions with the arteries or the veins. By no means this is medical advice, as you might be struggling, especially with some very serious conditions, strokes and clots and calcified arteries and swelling in the body, very serious things. This does not replace any of that medical advice. Work with your doctor on it. My job today with this blueprint for you and in this training is how do we give you some action steps? How do we give you some health supporting factors of nutrients that have been scientifically proven to help support healthier vessels? So I've got my guided notes for you. So right out of the gates here, you can click the link on this page that you're watching. You're able to download this. You're able to follow along. Very straightforward guided notes. Let me show you these right here. So vessel health. My gift to you to just be following along. I cover a lot of info with different conditions. As we go, you can follow along with that. That PDF is right there. Should be clickable, downloadable for you to be able to get. Let's dive in. The blueprints. Here we go. Calcified arteries right out of the gate. Big one, calcified plaques. Again, very, very serious condition. I'm assuming you're overseeing this with a doctor, but what can you do proactively? Because I believe in a lot of these scenarios, when we talk about arteries being calcified, we did something, ate something, consumed something, stressed something, lack of movement something. We did something to contribute to the status of that artery. Would you agree? We're missing a nutrient, we got too much of a wrong thing, put a chemical in, whatever it was, and it damaged that area. So I feel like we as lifestyle individuals controlling our own health have a part to play in this thing outside of just going to a doctor, get a drug, that's it for the rest of your life. I feel that if 90% of the time we put ourselves into a scenario, well, let's do some things to undo what got us there and see how much that can help. And then that's when you can monitor these types of things with a doctor. So calcified arteries, calcified plaque. Okay. And when we're looking at this, you start to look at the deposits that are going on, the heart attack risks that are going on, the calcification levels. And, zero, obviously we don't want any happening. We want the calcium to end up in the bones. But it starts to build up over time. And even with age, we get stiffening of those arteries. That would be a normal process. Minimal, we want to keep it to. But it can start to slide, okay, to mild and then moderate. And of course, if we get a lot of calcification in here, now this is kind of an oversimplified version of what this actually looks like, but you're calcifying the inside linings of it and you're not getting any movement. It can even create blockage inside of the body or inside the arteries, or you're not getting that movement. So then it's not expanding and contracting to control blood pressure, to give your heart the amount of blood, to give your extremities the amount of blood that it needs. So obviously this is a huge risk. And I've seen an explosion of it over the last several years. One of the studies that came out was Time Magazine of the secret killer and inflammation tied to heart attacks, cancers, Alzheimer's, and other diseases. That inflammation in the body building up, it's a fire. And so I really truly believe that every decision we make with our health, everything that goes in, moving or not moving, the type of movement we do, the type of movement we don't do, the stress we have, the stress we don't have, that all either adds gasoline or water to that fire. That makes sense? So I think you have a lot of control over this fire inside the body, and it damages over time, right? When this inflammation builds up, we start getting damage to those vessels and disease can start to develop. And then you get vulnerable to this plaque formation. And those are the ones that when that plaque breaks off, we really can start to see some problems. And when they break off and we have a clot or stroke or heart attack risk goes way up. So is there anything we can do to start driving someone back this direction or prevent you from going any further if you're already on this sort of scale right here? And I believe there's a lot of proactive things we can do to set up ourselves to support normal inflammatory response. So here's one of the main ones. When we talk about calcification, and then, kind of the other piece of this puzzle is inflammation that's also leading to that. We're going to talk about both of these. We're going to talk about your cholesterol numbers. When we talk about here, we're going to talk about your calcium numbers when we talk about the calcification. So kind of two things that sort of work a little bit in parallel. The cholesterol numbers, cholesterol is not the problem. It's the oxidation of cholesterol that's the problem. Remember that, okay? When something becomes oxidized, when something rusts, when something becomes calcified, and you can imagine the dump truck that's all rusty on the side, right? Or you can imagine the calcification built up in your shower. You see what I mean? So this is why we want to be very careful of certain nutrients like calcium going into the body or things like bad oils that drive inflammation and the oxidation of cholesterol, the fat inside your system. So here's the primary mechanism that calcification ends up in the wrong spot of how this ends up in the arteries and not in the bone where it primarily should be used. Now, calcium's used in a lot of different places, including the muscles, but most of it, right, we want it in the harder spots of the body. Now, what are we looking at? So first, let's measure the vitamin D when we go for tests. Where is the D3? Where is the D2? Now, and then your doctor may do some level of a calcium score. There's some artery scores they sometimes do. I think these are good things. Your doctor will lead the charge here. But make sure they add in D3. Because I think it's very crucial to know, well, if it's low, I'm impacting my immune system, I'm impacting my inflammation. That's going to have a big impact on arteries. But I got to have my magnesium and K2 with it. So you kind of want to have an idea of where you are. Then we want to actually measure the inflammation, right? These are my favorite ones for measuring the inflammation. And that's going to give you a better measure of what's happening here. So we've got vitamin D, we've got that calcium score. We want to look at those inflammation levels. Fibrinogen is another one that your doctor may be versed in. You could inquire about that, some of your clotting side of things. And then, of course, there's cholesterol. Now, let me just go off on cholesterol for a second. We go back up to this picture. I'm kind of tying in the plaquing, tying in the clotting, the calcification all together here, okay, the health of these arteries. So when we're talking about this kind of buildup, this picture, I don't want that, Dr. Livingood. That looks ugly. The oxidation of the cholesterol is the key, which means every single day you are making new cells. As you make new cells, you need fat. Fat comes from dietary fat and your body cleaning up and using current fats that are already in your system. This is huge. This is the problem with a lot of people that suffer from cholesterol imbalances. It's not that you're dietarily eating way too much cholesterol typically. Some of you maybe have overdone it. And I think if you're listening to me, you're following in some regard a nutritional plan of Dr. Livingood's to help get good fats in and to clean up your foods, clean up your sugars. If you're there, okay, we're on the right track now. What then happens, and this is what I see for a lot of you, is you start that journey and then your body, 75% of it, it's making itself. Where is it making it from? Okay, you're eating 25% of the cholesterol in your body. You're making the other 75%. There's a rollover process in your body as the cell dies. The dump truck takes the cell and the components. We tore down the building. We're going to build a new one. We tore down the cell. We're going to build a new one. It puts it in the dump truck. The dump truck is old. It's been on the road a long time. It's rusted. You got diesel, right? That is exactly what's happening right here. If the dump truck is really old and broke down, it's oxidized, it's rusted. But its job is to bring that cholesterol back to the liver and say, hey, here's another dump, and it's oxidized, damaged cholesterol. The body struggles to use it. This is a simple understanding of this. If you had a brand new dump truck, nice fancy one, maybe it's the one that's electric and just picks the dump truck in, and it's not rusted, that's newer cholesterol. It's easier for the body to reuse that, to recycle those things. So we want more of a recycling program going on than we do with the garbage program. I love how my analogies just evolve every time I get to teach them to you. So that's LDL. That's what LDL does. HDL is going to take and deliver, like a semi, the new materials to build a new house. That's HDL's job. Okay, so this is balance between them. The breakdown comes between, are we recycling or do we have a bunch of garbage? And so if you have a bunch of oxidized garbage, old cholesterol that's not rolling over and not being recycled in the body, this is what happens. So then the question is, well, how do we just get ourselves more in recycling mode? I'm glad you asked. That's a great question. How do we get our body more in recycling mode? And then what nutrients and what steps can we take to have less oxidation of the cholesterol in the first place? So again, let me recap here. For our artery health, we're focusing on two things: the placement of calcium in our body and the controlling of oxidation of cholesterol. Okay, so to measure how the oxidation process, the inflammation process is happening. So more inflammation is just meaning more oxidation. That is the LDL particle size and ApoB and CRP. Those are the three to look at when you're looking at your cholesterol. Do I have old dump trucks that are rusty? Is my LDL rolling across? So what will happen is you'll measure LDL particle size, and there will be a lot of small ones. They're wore down like tires that have just been driving and driving and driving. They're just going bald. Smaller LDLs. They're wore out. Those get oxidized. Those are the dangerous ones. They get stuck, okay? The bigger new ones, those are freshly recycled. So large LDL particle sizes, not the problem, okay? So that's the first one that you can look at to know, how's that oxidation process going? Then there's apolipoprotein B, ApoB. And this measures the number of particles of the ApoB protein that are in your blood. And this protein is involved in the metabolism of the fats, of the lipids for LDL. Okay, so this is measuring the metabolism, the breakdown, the recycling capabilities of LDL. So it's a good predictor of cardiovascular risk and more accurately can help you understand a cholesterol panel. I like the ones that tell you your risk more. Lots of LDL small particle sizes, higher risk. ApoB, high, higher risk. CRP, high, higher risk. Not, is your cholesterol up or not? It doesn't tell you your risk necessarily. It just tells you a number's high. Well, there could be a lot of reasons why that number could be high. And in fact, what we will see regularly, not with everybody, is you'll start cleaning up your eating, putting healthy fats in, eliminating bad fats, eliminating the sugars, cleaning up the proteins, everything that I teach you. In fact, there's a food list right in your PDF guide of what to eat and not to eat. You'll see sometimes your cholesterol levels will go up because you're going through this shedding process of getting rid of all of these damaged. It's almost as if the body's starting to clean this up. It's what starts to happen, right? It starts to clean all that oxidation up. Is it going to get it all out of there? That is not what I'm saying. But there's, in a process, this is being laid down and the body starts to clean that up. As soon as you stop oxidizing it, what's the main source of oxidation? Toxic food, bad oils, and sugars. The very basics that I teach you, no matter what meal plan, I don't care if you're vegetarian, I don't care if you're carnivore, I don't care if you're keto, I don't care if you just eat fruit, whatever you're choosing, you've still got to follow these rules to get this cleaned up. So there's our testing. Now let me go one step deeper, because as we understand heart disease, we understand it further. Scientists recognize that ApoB is a good one. The particle sizes is a good one. And these things get lodged, protein and small particle sizes, and cause the wall of it to thicken. And that's where we get plaques. So the total number of small particle sizes and protein in there matters a lot to the overall quantity. It matters more than the overall quantity of cholesterol that we carry. So check your ApoB, check your small particle sizes. If these are high, then you've just got too much of those particles floating around. We've got to take actions I'm going to show you in a second. But the one that supersedes them all, CRP. I love this study. I can't believe more people don't talk about it. This is a women's heart study published in the New England Journal of Medicine. Researchers studied the CRP levels in 28,000 American women. And they looked at CRP and LDL cholesterol levels in the women who have developed coronary artery disease. They're already here. So 28,000 women here. When you're here, CRP's up, typically. But what they studied and what they found, 4 possible categories of these women. The ones that had high CRP levels and high LDL levels. They studied high CRP levels and those that had low LDL levels. Then they looked at the corresponding low CRP with high LDL and low CRP with low LDL. So 4 different categories. Got it? CRP high, LDL low. CRP low, LDL high, LDL low. Got it? 4 groups. And they split them into those 4 groups and they looked at their overall risk and their mortality over time. The results are astounding. Most cardiologists would have expected that the women with higher levels of LDL would have been at the highest risk. LDL, my LDL's up, that's the one we all freak out about. And I'm not saying leave it unchecked, but look at this. Those would have been the highest risk. But in the study, not only was elevated CRP the best indicator of risk, but women with low LDL and high CRP were also at high risk. And this is because inflammation caused LDL cholesterol to oxidize and form plaque, which can clog the arteries. So the study suggests that C-reactive protein levels is a strong predictor of cardiovascular events, stronger than LDL cholesterol level, regardless of where that one is at. Meaning, when CRP is up, you've got this going on potentially. We've got to get that under control, turn on the recycling system, make sure we're not compounding it by putting in too much of bad calcium nor misplacing it. And we've got to make sure that our cholesterol levels are not getting oxidized. People like you struggling with this, can I do anything to lower CRP? Like, what can I do lifestyle-wise? Like, what can I eat? Anything I can do to bring that number down into normal level? And if I've got calcification, is there anything I can take? Is there anything I can do to try to lower, to impact, to get the calcium out of the artery and take it to the bone? Like, why is it ending up in the artery? Why is it ending up in my valve? That's what was so shocking to me. And you see studies like this, you're like, wow. And that answer is unequivocally yes. This study, by the way, is in your packet. But here we go. So what are the focuses? And here's a praise report. I had to pull it. I've been really stressing about recent coronary calcium score tests. It's still concerning. However, I just got the results of the carotid artery scan done this month. I turned 70 this year. My vascular age is 49. Boom! I had this test done in June of 2022. When I started the DLG lifestyle, my vascular age was 60. Turning back the clocks by 11 years. Now, she's still got to deal with if there's anything going on with the calcium score, but this is on the right path. She just hashtag I am the solution. By no means am I telling her to skip her cardiologist appointment. I'm just saying proactively Alternatively, if you've got stroke risk, clot risk, calcification known, and your CRP is up, or your LDL particle size or your ApoB is up, we got to go. We can't just sit there on medications and doctor visits. Go do those, but in addition to it, we gotta get going when it comes to taking care of us. Take that as a big stinking warning sign. And I say that with a lot of compassionate fire. So hang on if you're dealing with a lot of swelling, we're gonna get to it. What can we be focusing on? So let me take you to the foods. Fermented foods. Why? Huge source of vitamin K2. You've got calcification built up in the body. We gotta get foods that provide vitamin K2 to the body. Deficiency predisposes a number of chronic conditions. Osteoporosis, heart disease, heart attack, stroke, inappropriate calcification, heel spurs, kidney stones. If you've got calcium building up anywhere in your body, you got to start putting some fermented foods in. My favorite is sauerkraut. Sometimes it's flavored. I even got the kids eating it. You could do some kombucha. Just watch the sugar levels there if your sugars aren't under control yet. You could do kefir. We got to get some K2 in. K2, fermented foods. Greens, balance out the body. Give it these antioxidants. Greens, berries, superfoods. That's why I love these. These antioxidants are the antithesis of this. If this is created by oxidation, oxidizing, rusting the cholesterol, then we want to eat antioxidants. Make sense? Greens, berries, superfoods. Put them in your smoothies. Handful of spinach, blueberries, antioxidants. Then fiber. It doesn't have to be Metamucil. My God, you're eating like toxic corn and bad oil and sugar. Like, stop that. Why don't we do chia or flax or vegetables? There's other forms of fiber we can get in. That's going to help pushing this along, right? Fiber, lowering the cholesterol levels. All playing the part. What else can we eat? Not Cheerios, right? Cheerios just found it containing a chemical that is increasing heart disease risk. You know what's next? Lower inflammation. Chia and flax contain omega-3s. Fish, incredible source of omega-3s. Omega-3s are an incredible source of lowering inflammation in the body. Turmeric, one of the most studied anti-inflammatories on the planet. It's been studied for thousands of years to have an impact on supporting normal inflammatory levels in the body. Asparagus, full of fibers, full of minerals, helps lower the blood pressure, helps prevent blood clots, especially ones that can lead to a lot of serious illness. It works with the veins and the arteries to alleviate inflammation and accumulation. It boosts the body's production of glutathione. It's an antioxidant. It can help unclog. It has alpha-linoleic acid and folic acid, which we just talked about, can prevent the hardening of the arteries. It's a great antioxidant. So it's also going to help the kidneys. And if you've got calcium built up down there, so add some asparagus as your side. Garlic, 2004 study showed that garlic decisively blocks calcification and artery plaquing. And then an animal study that was done in Turkey found that garlic extract reduced plaque surface area and concluded that the effect was from its antioxidant activity. Garlic, I know these aren't the most breath friendly or taste bud friendly foods, but these are like, why are we not talking about this? This is rock solid stuff. Garlic helps reduce blood cholesterol levels and reverse plaque buildup. In a German study of 152 subjects with substantial plaque buildup, using 900 milligrams of garlic powder a day for 4 years caused plaque to reduce by 2.6%. Plaque increased by 15% in non-garlic takers. Put some garlic in. Avocados. They're excellent at lowering the heart score. So if you're struggling here, we got plaquing, we got to get avocados in. They're also very good for antioxidants with the inflammation because it's healthy fats. But avocados help with that coronary artery disease score. They're full of potassium, even more than a banana has. Rich foods in potassium help reduce vascular calcification. So we need extra potassium going in. Organic coffee is one of the best sources of antioxidants on the planet. And one study that's in your packet that drinking up to 3 cups a day can lower your risk of developing atherosclerosis or clogged arteries. I'll drink to that. I would put in supplemental K2 at least, but that's what's going to make that big impact on those artery scores of moving that calcium out of the arteries. We'll talk about it in a second. But these foods. Now, what creates this faster in the arteries? Let's remove those. Alcohol. We're going to talk about it with the liver and with swelling as well, but that's going to oxidize. Fructose, especially high fructose corn syrup, is going to oxidize quickly. Processed foods, full of oxidation. This is why I don't like the microwave and quick fix things and food that comes through a window or makes noise when you open it. Calcifies, oxidize. That's what that stuff does. Rancid fats and seeds, it's so important. I'll show you the list in a second. We got calcium. Supplementation wise, if you're struggling with artery health, I would not be taking any sort of high dose of calcium supplementation. Now, what I mean, like, above 200, 300, 400 milligrams, right? You're taking 100, you're getting, 10 in your multivitamin, you're getting 30 in your multivitamin. I'm not worried about that, okay? Little bits. But those of you taking 400, 500, 600, 1200 milligrams because you're worried about osteoporosis, that is not your problem. It's your replacement of calcium that's the problem. It's not just pounding the body with more calcium. You're asking for oxidation doing that. So you might want to pay attention to some of those foods even. Now, in your guide, we just put this whole thing for you, okay? There's your list. There is a meal plan link. Also put a 3-day juice cleanse for you. This is a great artery cleanse. Why? Oxidize, oxidize, oxidize. We're just putting in a bunch of oxidation. Those are easy breakdown. Now, we got the foods. We understand the tests. Here's the focuses. So I just showed you the challenge meal plan. The advanced meal plan is huge because you begin to activate the recycling process. Activate the recycling process, autophagy. If you can fast or juice, that's why I gave you that green juice cleanse, okay? If you can do this for 3 days and keep it very low calorie, less than 200 calories a day, you maximize autophagy, which is your body's recycling system. If this is created by cholesterol that's not recycling, that's calcium that's not recycling and going to the right place that it needs to go to, then how do we activate recycling? We cut off the source of garbage and we activate it through doing the cleansing because it's activating recycling. And at minimum, you could do the advanced meal plan, which is going to start putting you slowly through that process. So if you're afraid to jump straight into like 3 days of no eating, I totally understand. But this meal plan does it. That meal plan, the advanced one, is in the challenges. Now, I would also consider cleansing the liver. Why? Because that's what's in charge of rolling over the cholesterol and driving this inflammation. That's what's processing all of it. That's what's doing this process right here. Converting that vitamin D, where do you think it happens? It's in your liver. So if that's all bogged down, this all gets compromised. So I'd highly recommend cleansing that out. Nutrients wise, let's break these down. These 3 big ones. Nattokinase is tough to find. It's exploded because of stroke risk going up, clot risk going up, plaquing risk, calcification risk, especially over the last few years. There's just really been a tick up in that. And so nattokinase, difficult to get, and you have to get it from a fermented form. So it's gonna be higher in K2, but itself naturally has a potent fibrinolytic. It has this propensity to have an impact on clots that are being formed. It's antihypertensive, it's atherosclerotic, it can help support lipids and normal lipid levels and normal platelet levels and the coagulation process. And it's a very neuroprotective nutrient. A single dose of oral nattokinase has a lot of impact on this buildup going on right here. It's a bit of a cleanser for that oxidation that's happening. Okay, so nattokinase, big nutrient. Single dose of it in a day has a big potential anticoagulation profiles. Shows the research. You have this study. So nattokinase. Number 2, vitamin K2. I feel if you're struggling with arterial calcification and the artery risk, there needs to be a higher dose of K2, at least for a period of time. Now, this isn't K1, this isn't blood thinning, this is K2. Now, you can always ask a doctor, you can always ask your pharmacist of something you may be taking if there's any kind of interaction, but this is K2, it's a different mechanism. Taking it daily can result to an as high as a 50% reduction of arterial calcification, 50% reduction of cardiovascular risk, and a 25% reduction of all-cause mortality. That was just a study done on vitamin K2, okay, just relaying it. So 25% reduction of all-cause mortality. So this is just one that a lot of people are lacking on when it comes to artery health. The last one is diosmin. Diosmin nutrient has a big impact on the overall health of the arteries, how it functions, the blood flow of it, leg circulation, heaviness, burning, cramping. So it's a great nutrient to help support the overall health of the arteries and the veins. It's a bioflavonoid. I love bioflavonoids. It's found in citrus fruits. We often don't get enough of them, but this one has a big impact on vessels and veins overall. We'll talk about it a little. But the main one, if you're struggling, is nattokinase. Nattokinase has a huge impact. Fibrinolytic, fibrin tissue that's starting to build up in those. And then K2, those are the top 2 nutrients. Research-wise on it, here's the research. You have this in your packet of how diosmin's helping leg issue-wise, the reduction of K2. K2 resulting in 50% reduction in arterial calcification. Nattokinases, its effects, the single dose of it, and how it helps in the thrombosis forming, the clot forming. So this is the big risk. It's just another nutrient that a lot of people aren't talking about, that putting it in there, can it help support normal vessel health? With the studies, that answer is very clear. You may add in some cholesterol supporters, garlic extract, plant sterols, beta glucan. These are in my cholesterol support. That might be an option for you as well, but there's the main focuses. There's the main foods to be eating and putting in. Here's the main tests. To make this easy for you, if you are concerned, I want to support healthy vessels. I want to support a normal, healthy coagulation process, oxidation process. I know I got to eat more asparagus. I know I got to eat more garlic. I know I got to eat more fish. I know I got to eat more berries and greens, but I want to get these nutrients in. What's the easy way to do it? A lot of people very worried about this area. How can we go on the offense? Supporting a way of eating, cleansing, omega turmerics, and then getting these nutrients in. If struggling with or concerned with the support of your vessels, how do we support normal vessel health, normal vein health from the artery side, the nutrient side, flowing in to the garbage, returning it to the liver side? And it's all these microcapillaries is where a lot of problems exist. This makes up the majority of all of your vessels and veins. And so we want this exchange of nutrients and garbage to be proper, to not build up in here, to activate the recycling process, and to give the body the proper nutrients so it can place calcium and it can control the oxidation and the inflammation in the body. And this sets you up to help support normal vessel health. Okay, so implement the lifestyle to give yourself the best foods, eliminating the bad oils, getting the movement, decreasing the stress, add the nutrients to help support. There's your formula for the vessels, in my opinion, to set yourself up with the best nutrients long-term. Now let's go with something that relates directly to it, peripheral artery disease. So in the periphery of it, not just around the heart, not just in the main carotid, but now out here, we're getting atherosclerosis building up and it starts to pile. And now we've got stroke risk, clot risk. It can rupture, embolisms, a lot of different things that can happen here. Okay, how do we help support these if they're expanded, if we have potential risk of embolisms breaking off, clots breaking off, things being clogged up, preventing any kind of rupture? Where do we go with these things? Well, let's go back to the testing. Okay, let's look at that vitamin D score, or vitamin D levels. Let's look at the calcium score. Let's measure our inflammation, especially that CRP, because that's going to tell us inflammation and cholesterol status and risk. You can look at fibrinogen if they'll test it. And then we've got those main ones, LDL particle size, ApoB. Okay, these are all playing a big risk into forming this. This gives you a measuring stick so that as you implement, I'm going to start the breathing exercises. I'm going to start following the meal plan. I'm going to start doing the 10-minute workouts. And then if you're doing a follow-up test 3 months later with your doctor, you can see how your lifestyle changes might be making an impact. And that's a good conversation that you can then get with and have with your doctor. Say, hey, I'm doing my work over here. I'm working hard to get better. What are you seeing on the test? If they're improving, can there be less toxins, less treatment involved at that point? That's what you're working out with your doctor. My job is to help you, equip you with the lifestyle changes to get you there. So again, a food list, very focused on a lot of those same things. However, a couple nuances, right? Some onions in there. This is going to add in some extra bioflavonoids. I really like that for the health of those peripheral arteries. It has quercetin in it. So quercetin is a very good helper of the peripheral arteries. Also to point out on here, cassia cinnamon is a good natural coagulation buster upper. Some good cinnamon in there. And then spinach. 1 cup of spinach a day can lower your PAD risk of 26%. The risk of this by 26%. 1 cup of spinach a day. My favorite way to do it, put a handful of it into a smoothie. That's why I suggest this kind of stuff. They literally did the study. 1 cup of spinach a day can decrease your risk of peripheral artery disease by 26%, shows research. Why do we not talk about that? Baffles me. So, a couple of tweaks, but again, you're cutting out those main foods. We're not as much focused on necessarily the calcium issue here unless you have that, but I still would get fermented foods to get some vitamin K2 in. Focus is wise, okay? Activate autophagy. Follow the challenge eating plan, and then in week 4, we want to activate autophagy. Nattokinase, diosmin, get the bioflavonoids, K2, prevent the calcification, support normal fibrinogen and fibers being laid down, support the integrity and the health of the vessels and the veins. I would consider vitamin D3 complex. You cannot take vitamin D3 without K2 and magnesium, in my opinion, if you are concerned with the health of your arteries, the stiffening of your arteries, the calcification of your arteries, and peripheral artery disease. I think it is so very important because D3 is going to push that calcium into your arteries. So if you're just taking a bunch of prescription vitamin D2 or you're taking a lot of D3 and there's no K2 involved, and in my opinion, magnesium involved, I think you're greatly missing out and you could put yourself at risk long term. Vitamin C, very good antioxidant. Omega plus turmeric, getting the healthy omega-3s, controlling those normal inflammatory responses, and then support your cholesterol if you need extra support there. If you're already in this spot, you're working with your doctor, but your job is to make these changes to see, can you move these numbers by you implementing the focuses, executing the lifestyle, doing the challenges, supporting nutrients. There's the focuses. Okay, then we move into some of the other catches of what goes on, like the thinning of it, clots and thromboses and DVT and embolisms. Guys, this is very serious things, okay? If you're struggling with these things, get your medical care. This is not replacing any kind of medical device. What I see oftentimes is people get through it, just like with cancer. You get through it, and then afterwards, it's like, well, you forgot to fix the sick person. You get through some kind of clot, some thrombosis, you have a DVT risk, you have an embolism risk, and you're just like stuck in that risk the rest of your life. Like, what do you do after those things occur? The medical emergency's over. What do we do with the sick person? Because healthy people don't get these things, sick people do. Well, I'm not sick, Dr. Livingood. I don't agree with that. What I'm saying is that there has to be a chink in the armor somewhere. There has to be an overall impact of the amount of inflammation inside of your blood, the amount of inflammation inside of your body, the amount of oxidation that's happening inside of you has got to be off kilter for these things to form, or your body has been wounded and it's trying to heal an area that's been wounded, which again means you're not sick, but you're damaged, right? So you're damaged or sick in some way to be driving a lot of these things. Now I get it. There's some genetic things going on. I'm not referring to a few of those kind of wild cards that I'll call them of I can't impact that game, so I don't play that card. The game we're going after is the 90% of lifestyle factors that put you in a state where these things are worse, where things are breaking off and we have clots going into the lungs from an embolism side of things, or into the veins in the legs where we have deep vein thrombosis, or a clot into the arm, or in, heaven forbid, into the brain. So a lot of times when these go down, blood thinners, it is nothing to mess around with. And so you need to talk with your pharmacist, with your doctor when you're talking about these conditions. But a lot of times they're looking at some of these coagulation tests. They might use all of these, they might use some of these, but I like to get and start setting you up with like, what are the numbers? Like, what are they looking at to determine if you're on a blood thinner, if you have this blood thinning problem, if you have this higher risk of clotting, like what are they watching that is going to help you to understand, can I move the numbers? Like immune health, like we just talked about, vitamin D3, I can watch that number and know, can I do something about it to improve my chances of having a stronger immune system? Oh, now I understand CRP. Can I move that number so I can understand, am I making my inflammation better or worse? I'm asking my doctor for those things, but I'm doing my part. I'm looking at ApoB and my small particle size. Can I do something in my lifestyle to change those numbers? You see, I think if we can set you up with a measuring stick, you're not replacing medical advice. You're just saying, I want to do something to help that too, or lessen the need for a drug or an intervention. So these are some of the ones that they can look at. PT time, you're evaluating the ability to clot. Your IRNR ensures that the results from the PT test are the same from one lab to another. So you've got consistency. There's a PTT time that it determines if blood thinning therapy is actually doing its job. So you're measuring the effectiveness if they have you on a drug. They're measuring test to test, and they're measuring that clotting time. So some of them use this, some of them have more sophisticated means, but just gives you some examples of some of the tests that you can look at. Like, how are you measuring it? Is it with one of these that we're looking at clotting, or how are they really taking a good look? Now, I will tell you some of the other ones to take a peek at. D-dimer is a simple blood test that can help your healthcare provider determine if you have a blood clotting condition. That might be the one. Is there blood clots going on? Or if you're worried about it, see if they'll do a D-dimer. It's measuring clotting. Is there a clotting problem going on? Other things that impact it. I think ferritin's really important. If you got high ferritin, you got high amounts of iron inside of your liver and your blood. That means heavier blood. That means higher clotting risk. So we got to know ferritin. If it's high, go back to liver cleanse. Inflammation. The more inflammation in the blood, the more platelets we have, the more erythrocyte sedimentation rate. It's clotting, it's clumping. CRP is up, it's damaging the heart. That means more risk for clotting. You could look at fibrinogen, cholesterol. Are we sticky? Are we oxidized? Do we have small particles? Do we have a bunch of protein, ApoB protein floating around? That's all going to increase clotting. I hope that makes sense. You're just looking at the numbers of like what's driving some of these things, and then how can you be more equipped of like, wow, Dr. Livingood just gave me a little understanding of my numbers, and then I want to take action and do some things. Okay, so what can I do, Dr. Livingood? Like, how can I start impacting this? What are the foods I could be adding? I like fish oil. Listen, if you're on a blood thinner for some of these foods, then talk to your pharmacist. Talk to your doctor if you can eat them. But I like fish oil. I like omega-3s. It's got a great impact at the inflammation. Pineapple, bromelain, it's an antioxidant. Now, if you have sugar problems, I wouldn't advise that one to start, but bromelain's a good one. Fiber, lowering the cholesterol levels. Chia, flax, omega-3s, and fiber. These can easily be added to your smoothie. Eat the fish. Add turmeric. Again, if you're worried about it interacting with some kind of medication you're on, talk to your doctor and the pharmacist about the medication. But it's a natural food that can be added in. Cassia cinnamon has impact. natural levels of blood thinners in it. Something that could be added, like simply to your coffee. Like I'll put cinnamon in my coffee all the time because it has an impact on blood pressure. It has an impact on the health of the arteries. Might be a good option for you. Things that could be added in simply. Garlic. I just showed you the studies of how it impacts the health of the arteries and the oxidation process. Lots of veggies. Just don't give you the simple stuff. Like, could these foods make an impact and move the needle of these numbers for you? Unequivocally, yes. Add them in. Get the alcohol out, the smoking out, the high fructose corn syrup, the processed foods, the microwave, the food through the window, and the packages of food when you open it. If that's primarily what you're doing to your body, you are asking for this to happen. It's just too well known. And then those rancid fats and rancid seed oils. Food goes a long way with this thing. Now, what do? Doc, I've been exposed to chemicals. I've been exposed to meds. I've been exposed to bad foods. I've been exposed to bad fats. I've been exposed to, like, how do we just start going about this thing? Well, number one, we got to activate autophagy. We got to activate the recycling system of your body is the most powerful thing you can activate. It starts cleaning up old cells. It starts cleaning up these things that are clotted, clumped, sitting there, oxidizing, garbage. Cleans up the garbage. Rebounding. Now, if you're in the middle of a leg clot, please don't go doing a bunch of physical activity. What I'm meaning is when things are clear and you're wanting to improve the circulation of your legs so that you're not having pooling or improve the circulation in your lungs, jumping on a mini trampoline has been proven to be a very good way to stimulate the circulation and pump the blood back up to your heart. 10-minute workouts. You've got to be active. Avoiding crossing your legs. I just uncrossed mine. How about you? Now, I know when you're giving blood, you can cross legs and then squeeze them together. That's to get the blood out of your legs back pumping up to your heart so you've got more flow back up into your head. So there's exercises that you can do to squeeze those legs when crossed, but a lot of times we just have them crossed and we're pinching or impeding clotting in the legs. Elevate the legs sometimes. Dry brushing. Take your hairbrush, the one with the hard bristles, women, give it to the husband or you, brush your legs towards your heart. Brush your arms towards your heart. It leaves that red mark on your skin or that white mark on your skin, and that scraping stimulates the circulatory blood flow. Dry brushing. Again, nattokinase, very important here as far as the impact it's having on normal healthy arteries. Diosmin, K2, vitamin C, bioflavonoids, omega turmeric. We've talked about these. Add the cholesterol support if needed. If you need extra support there, we've got to load up on bioflavonoids, right? We want those bioflavonoids going in. We want that nattokinase. That's the approach I would take if we're worried about clotting going on. And then when you're activating autophagy, you're cleaning those things up. If you've been exposed, like it was a chemical that has now increased your stroke risk or increased your clot risk, I would be pursuing the liver cleanse. What are the nutrients and things we can go on the proactive to really start putting those in and supporting these very, very important tubes that carry all the nutrients and all the messages that our body needs on a daily basis. So there's so many foods you could be eating to help support that. There's so many things you can be eliminating to help support that. There's activities of rebounding that you could be doing to help support these. That's how you become the solution. Not Dr. Livingood, not the pill, not the doctor, not the diagnostic. You are the solution to what you're looking for. You are the change. There it is, peeps. Take care of this other very important part of our body. All the vessels, stretch them out. They reach all the way around the world, 16,000 miles.